Good afternoon. Hope not too much blood is going to your gut here and you're ready for a siesta. So I'll try to keep you awake and I'll try to keep these slides going. So Stephen Foster-Wexler, acupuncturist here in Bend, been in Bend since 2003 and work up in Northwest Crossing area. No products, no financial disclosures, no relationships to either of these organizations. So yes, 8 slides in 8 minutes. Ready? Oh, and we're not going. Okay. Oh, sorry, wrong buttons, I guess. All right, let's see if this one works. So, first of all, is that the first slide or second slide? So acupuncture's got a lot of misrepresentation, misconceptions, misunderstandings. Hopefully here, as Dr. Raymond showed you, educate you a little bit about acupuncture, not much, because you can't do much in 8 minutes for a 4-year medical program, but also some pros and cons, show you some of the research that's out, more new research, and help you to understand how to refer. That said, we are not just throwing darts at patients, right? There's a little bit more to it. So briefly, Chinese medicine, one thing to understand is it's a comprehensive medical system. Acupuncture is one of the modalities of Chinese medicine. I mean, you're familiar with Chinese herbal medicine, pharmacopoeia. Allison mentioned we do body work too, exercise therapy, like in Qigong or Tuina. Dietary therapy is a part of it also. So it's really, we don't just treat chronic pain, but can treat internal medicine as well. Chronic pain is a part of that. Treating body, mind, and spirit, we often say, if you have problems emotionally going on, like as mentioned from the ACE studies, or trauma, that's going to contribute to your pain, as well as some spiritual imbalances. Part of Chinese medicine, we do differential diagnosis. I mean, it's not just symptom-related treatment. So every patient that comes in, I spend time with them and do a complete look, listen, and ask, touch, to come up with a pattern that we then treat towards the pattern and reevaluate to make sure that they're coming in balance with that. Chinese medicine has a very different language often than you're used to. Concepts of qi, yin and yang, 3 treasures, 5 elements, 6 pathogenic influences, 7 emotions. I mean, I was just saying I was a mathematician before this, and I'm glad because there's a lot of numerology. But moving on from that. So, if these slides are in order. So this is a World Health Organization list that was put together just about 20 years ago and is, we feel, ready for updating. And if you can read the fine print there, this is just the first category and a partial list of the first category of diseases, symptoms, and conditions for which acupuncture has been proved through controlled clinical trials to be an effective treatment. I've bolded the ones that are pain-related, or generally pain-related. There were 3 other categories, and I don't know how many people have looked this up on the WHO site. I mean, it's now been up for 19 years. 3 other categories. The second one is therapeutic effects that have been shown, but more proof is needed. The third category is just individual controlled trials that had therapeutic effects. And the last category is actually interesting, that's saying, well, we feel that acupuncture and oriental medicine should be tried in these cases because they possibly show a benefit, whereas biomedicine or Western medicine doesn't have a way to treat these. So it's a good use for those. So that's, again, 1998, a while ago. Some of the pros with Chinese medicine, as I mentioned, face-to-face time. I know it's a frustration for a lot of providers now, and especially in our insurance-driven practices, of how much time we get to actually spend with the patient. Well, most of the Chinese medicine practitioners I know do set up their practices so that we can spend plenty of time to hear the patient and find out what, let them tell us what's wrong with them, basically, as traditional medicine historically did. So that's a positive. It's a holistic form of medicine in that not just symptoms, but this idea that differing symptoms relate. An example of that is now being the fall. Fall is a metal time of the year. It's a dying back, and so we have concepts of grief with that. Fall also, and metal also rule organ systems related to the lung and large intestine, which is, and so you'll find sometimes people I worked in hospice 12 years, people having a lot of grief will start to develop bronchitis issues. And those are very related in Chinese medicine, that they're having metal issues in their body, or they're having constipation. They can't let go, whether emotionally or physically. So some of these things, that's just a brief example, but there are seemingly very different symptoms going on in the body which relate very factually in the Chinese medicine approach to looking at the body. Positive side effects, of course, most people say, I feel very relaxed, I'm sleeping better, my appetite has come back, I had the best sex ever after that last treatment. I have to put that one in. I've heard that multiple times. I don't know why they tell me that. TMI, but it's on there. I say just go to Google, write a Google review. 3 minutes, okay. Cost savings. So generally, has been the case with the financial studies is that using some of the integrative and complementary therapies do reduce costs, if not just reducing emergency room visits, which we know drive up costs. And safety, which is thankfully big because it keeps my malpractice costs very, very low, because there are virtually no serious adverse side effects when performed by licensed acupuncturists, we find. Some of the cons, acupuncture, Chinese medicine is still thought of as an alternative form of medicine, and that's a mental state people are in. Compliance, it's generally, as with many of these other modalities, patients have to do a series of treatments. It's occasionally you get the patient who comes in, you do one treatment, and magically everything changes in their body, but that's not typically the case. So compliance for patients to keep on the herbs, keep coming to appointments. Can be financial barriers if they have to pay out of pocket. Treatment lengths vary, and it's still not well integrated into our medical system, and that's the biggest beef, of course, for me. So get into 2 quick studies here. The first study is about migraines, and both of these studies I just took from this year, 2017, both from JAMA. So, I wanted to pick the most recent. There are so many more well-done controlled clinical trials now. First one is migraines. This is a 24-week trial, 4 weeks of treatment, a 3-arm study with a sham acupuncture group and a waitlist group. And treatment was given for 4 weeks and followed up for another 5 months basically after that. And the conclusion, if you can read that, says compared with the sham acupuncture waitlist control group, treatment acupuncture manifested persisting superiority and clinically relevant benefits for at least 24 weeks in migraine prophylaxis, including reducing the number of migraine frequency and days with migraine, as well as decreasing pain intensity. So it's pretty conclusive. And it's one of the ones that OHP covers acupuncture for when we get to that. The second study is for post-surgical TKA here, and again, looking specifically at reduced pain and reduced opioid consumption by using acupuncture. So jumping to the end here, and this was a meta-analysis done, a systemic review. So conclusion here says, in this meta-analysis, electrotherapy and acupuncture after total knee arthroplasty were associated with both reduced pain and delayed opioid consumption. So last slide. So expected provider outcomes. Generally, to refer patients, the patients for here are patients that don't want to have intervention, that don't want to take meds, that want to try, or they've been trying something for 15 years, all sorts of things, and they finally come to Chinese medicine. Carrie mentioned that we should talk about, how it's paid for. Medicaid does not cover acupuncture at all now, unless you're on a federal employee plan, FEP. Then it covers 100%.
That's not true.
Well, some of the Medicaid supplement
Anything on the spine.
for acupuncture, Medicare does not cover. Medicaid, the Oregon Health Plan, does have coverage, but you need to have a prior authorization first before. I just got 3 calls today. I hear you cover Oregon Health Plan. Can I come see you? Say, go to your primary care doctor, get a prior authorization. you know, until that 6-digit number is on your HCFA form, I can't see you. So, and I'm happy, I educate doctors about this all the time. I know that system, call and talk to me. Other insurance plans, group plans, many still do cover. Any of the individual plans in Central Oregon do not anymore as of this year. And my time's up, so thank you very much.